Namaste to all. I am Dr. Mahwa Siddiqui, a family physician. Subdural haematoma refers to abnormal collection of blood between the skull and surface of brain under the dura mater, one of the protective layers of the brain tissue. SDH is the most common type of traumatic intracranial mass lesion and is much more common in men. It is associated with abusive head trauma, especially in pediatric patients. Cranium extraction device and traumatic delivery accounts for a majority of the SDH in the newborn period. It is also common in elderly people because the brain shrinks with age, creating more space between brain and skull. This in turn stretches the veins located there. This can be compounded into a much greater risk of if the person is receiving anticoagulants as well. Besides non-traumatic intracranial hemorrhage due to cerebral aneurysm, AV malformation or tumor, craniotomy, CSF shunting, intracranial hypotension can all lead to SDH. In a SDH, symptoms such as headache, feeling like vomiting or actually vomiting, confusion or speaking difficulty, weakness in an arm or leg, drowsiness, vision problems, walking and balance problems, seizure, loss of consciousness may occur immediately or they may occur days to weeks later. A small bleed may resolve spontaneously, however, a large bleed may increase the distance between the bridging veins and lead to an extensive amount of blood around the brain, ultimately leading to herniation of cerebral structures, subphalangeal and transtentorial, the commonest to name. SDH is diagnosed by scanning the head, typically using a CT scan, which shows a crescent shaped mass that follows the inner surface of the skull. The immediate treatment of SDH is management of airway breathing circulation as assessed by Glasgow Coma Score. Hematoma evacuation by craniotomy is the surgical treatment. Burr procedure can also be done. In a large number of patients requiring emergency decompression, more than half had lucid intervals, that is, they were able to talk between the time of their injury and subsequent deterioration. Mortality rate of a subdural hematoma is extremely high from 30 to 79%. The topic is only about acute subdural hematoma and not chronic subdural hematoma. Do take loads of care and do keep all the sick patients in your prayer.